Hello and welcome to the YouTube channel Pharynx Anatomy. Today we have with us the cross section of the head and neck, and the main focus for today's video is on the pharynx. So before describing about the pharynx, let me tell you what are the structures which are visible over here. So this is the nasal cavity, where it is the anterior nasal apparatus from where the nasal cavity will start, and this is the inferior nasal concha, this is the middle nasal concha, and over here you will find the superior nasal concha. So three conchas are there, that is visible over here. Above this is the sphenoidal space. Here you can appreciate a gap is there. That gap is, this is the frontal air sinus. Some of the frontal air sinus you can also visualize in this area. Another space that you can visualize over here, okay, this is nothing but the sphenoidal air sinus. So this is the sphenoid bone. The air sinus is the potential space that is resides within the bone. After that, you can also visualize this is the oral cavity. This over here, this is the oral cavity. Above the oral cavity you will find the hard palate. This is the hard palate, and posteriorly over here you will find the soft palate. This is the tongue. After that, you can see that this space is continuous downward. This is the esophageal area. Over here you will find the esophagus, and over here in front of that you will find the trachea. After that, you can also appreciate some of the bony structures over here. These are the vertebra, cervical vertebra. So this is the specimen of the sagittal section of the head and neck, and the structures that are visible that we described already. Now let us focus on to the pharynx. So pharynx, it is a muscular membranous tube which extends from the posterior nasal apparatus all the way up to the pharyngoesophageal junction. Okay, so let me show you. This is the anterior nasal apparatus, and over here just posterior to your inferior nasal concha and middle nasal concha you will find this opening over here. This is known as an posterior nasal apparatus. So that is the area from where the pharynx is started, and it will extend it all the way up to the pharyngoesophageal junction. So somewhere around here you will find the pharyngoesophageal junction. If you are going to see the length of the pharynx, it is somewhere around 10 to 15 centimeter in length. Okay, over here we have already dissected the laryngopharynx. That is why you will not be able to see the full extent of the pharynx. The length of the pharynx is 40 to 50 centimeter in length. The maximum width of the pharynx is approximately 3 to 3.5 centimeter, which lies at this level. Okay, so this is the nasopharynx. The nasopharynx is the area where the maximum width of the pharynx is present. Apart from that, in the rest of the area, the length will be somewhere around 1 to 1.5 centimeter. Pharynx can be divided into three parts, which are the nasopharynx, which lies posterior to the nasal cavity. Then you will find the pharynx, which lies posterior to the oral cavity, that is known as an oropharynx, and the structures that lies posterior to your larynx, which is known as an laryngopharynx. So these are the three dividations. Let us see each and every dividations in detail. So first we will talk about the nasopharynx. Okay, so nasopharynx extended from posterior nasal apparatus, or also you can say this is the body of the sphenoid bone. The structure, triangular structure, if you can visualize, this is nothing but the body of the sphenoid bone. So that is the area from where the nasopharynx is started, and it will extend it all the way up to the lower border of the soft palate. So over here you can see the lower border of the soft palate. This is your soft palate, and this is the lower border of the soft palate. This is also known as an uvula. So your nasopharynx is extended from posterior nasal apparatus all the way up to the lower border of the soft palate, or you can also call it a uvula. So this is the territory of the nasopharynx. Now laryngopharynx. The laryngopharynx is a small part. It is extended from the lower end of the soft palate or uvula all the way up to the epiglottis. So this area over here, this is nothing but the epiglottis. So that is the extension of the oropharynx, and then the rest of the part that is extended or situated behind the larynx. Okay, this is the area of the larynx. So whatever the structure that is present behind the larynx, this is known as an laryngopharynx. So this is the dividation of the larynx in relation to the soft part, or we can also talk about the relation of the hard structure or the bony structures. So for the bony structure, if you are talking about the nasopharynx, it is extended from the body of the sphenoid all the way up to the C1 vertebra. So that will be the territory of the nasopharynx. If you are asking the oropharynx, it is extended from C2 to C3 vertebra. That will be the extension of the oropharynx, and then from C3 all the way up to the C6 vertebra, that will be the territory of the laryngopharynx. Superiorly, the larynx is limited by the body of the sphenoid, whereas inferiorly it will continue with the esophagus. Pharynx connected anteriorly with the nasal cavity. If you are asking about the oropharynx, it is communicating with the oral cavity, and if you are asking about the laryngopharynx, it is communicating with the larynx anteriorly. If you are asking about the posterior relations, so you will find from C1 to C6 vertebra are there, which is rely into the posterior to the pharynx. Apart from that, you can also appreciate, if I am abstracting this area, you can find out the potential space is that is known as an prevertebral fascia. After that, these are the prevertebral muscles are there. Then the retropharyngeal space, this space after between your prevertebral fascia and muscle, that is known as an retropharyngeal space. So that is about the general introduction of the pharynx. So after general introduction of the pharynx, now let us discuss the parts of the pharynx in detail. So the first part that we are going to talk is the nasopharynx. So nasopharynx, if you are going to see the territory of the nasopharynx, it is extended from the posterior nasal apparatus. So over here, this is the posterior nasal apparatus. It is extended all the way up to the uvula. So that is the territory of the nasopharynx. Now let us see the boundary of the nasopharynx. Anteriorly, the nasopharynx is bounded by the nasal cavity. Superiorly, it is bounded by the body of the sphenoid. Posteriorly, it is bounded by the prevertebral muscles, prevertebral fascia, as well as C1 vertebra. Okay, so that is the posterior relations. Inferiorly, it is bounded by the lower end of the uvula, or you can simply call it the lower end of the soft palate. So these are the boundaries of the nasal cavity. After understanding the nasal cavity's boundary, now let me show you the internal of the nasopharynx. So the first thing that you will appreciate in the internal structure is the nasal tonsils, nasopharyngeal tonsils. Nasopharyngeal tonsils, it lies along the roof area over here, somewhere around here. But it is well defined in the child, but it is not present in the adult. So this is the cadaver of the old age. So definitely the nasopharyngeal tonsils, you can't visualize it over here, but it is lying in this area. It lies near the body of the sphenoid. So that is the first internal structure that you need to remember. The clinical part is there for the nasal tonsils. That is, sometime due to the infection, what happened, this nasal tonsils become hypertrophic and it enlarged or inflamed. So what happened in that case, this airway path is obstructed, because this nasopharyngeal tonsil is present in this area, and when it's get enlarged, it is going to obstruct the pathway of the air that is coming from the nasal cavity. So in that case, if the person has the inflammation of the nasal tonsils, okay, person may taking the oral breathing. Then we are going to talk about the another landmark, that is nothing but the pharyngeal isthmus. So pharyngeal isthmus lies in this area over here. Let me show you. this is the area where pharyngeal isthmus lies. It is nothing but the gateway for the nasopharynx to enter into the oropharynx. So this is the area where the pharyngeal isthmus is lies. Pharyngeal isthmus, anteriorly it is bounded by the soft palate. Posteriorly it is again bounded by the prevertebral muscle and fascia, whereas on each side, that you can't see in this specimen, on each side it is bounded by the palatopharyngeal arch. Okay, so that is the boundaries of the pharyngeal isthmus. So now you will be aware about the nasopharyngeal tonsil as well as pharyngeal isthmus. Okay, during the swallowing, what happened, this pharyngeal isthmus, okay, getting closed like this, it prevents the regurgitation of the food from your esophagus. So that is the function of the pharyngeal isthmus. On the lateral aspect of the nasopharynx, there is an opening of the auditory tube. So that will be your third landmark. So this is the lateral wall of the nasopharynx over here. Okay, let me show you. Over here there is a small opening is there. That opening is known as an opening of the auditory tube. Auditory tube is creating a communication between the nasal cavity and the tympanic cavity. So after that you can also appreciate there is an elevated area onto the superior aspect as well as posterior aspect of this auditory tube opening. That elevation is known as a tubal elevation. So tubal tonsil is generally present overlying in these areas, but again this is because this is an old age cadaver, so you can't appreciate the tonsils over here. Otherwise the tubal tonsils are present in this area. After that, let us discuss the fossa of the Rosenmelon. So after that, you can see this elevation is that posterior to this elevation you can appreciate a gap over here. Okay, so this gap is known as an fossa of Rosenmuller. Okay, internal structures of the nasopharynx. Again, quickly recap what are the structures in the internal part. So you can appreciate the first structure that we talked is the nasopharyngeal tonsils, which is present with the the body of the sphenoid. Okay, so that is the tonsil, nasopharyngeal tonsils. After that, we discussed the pharyngeal isthmus, which is a communication between your nasopharynx and the oropharynx. So that gateway is known as an pharyngeal isthmus. After that, we also talked about the opening of the auditory tube onto the lateral wall of the pharynx. That is a communication between the nasal cavity and the tympanic cavity. After that, you will appreciate this elevation over here. This elevation is known as an tubal elevation. Okay, on posterior to that tubal elevation, you will find this depressed area is there. That depression is known as the fossa of Rosenmuller. Okay, this is the fossa of Rosenmuller. So these are the structures that you need to remember for the nasopharynx. So after discussing the nasopharynx, now let us understand the few important clinical anatomy that is related with the nasopharynx. So generally we all know that we use a Ryle's tube to provide the food path for the patient who is unable to eat through the oral cavity. So for that we use the nasal cavity. We insert the tube from the nasal cavity and it will be extended like this. It will goes into the nasal cavity and it will extend it all the way up to the nasopharynx, and then it will descend downward like this, and then it will go into your esophagus, and then it will end up into the stomach. So that is the pathway for the Ryle's tube. Ryle's tube is generally, it is not only used for the providing the food, it is also used sometimes for the gastric lavage. Insert the ET tube, that is the endotracheal tube. So for ET tube we access the oral area. So generally the ET can be passed to the oral cavity and it is extended all the way up to here. Here you can appreciate this is the epiglottis. Okay, so what happened, we use the laryngoscope. Through that laryngoscope we open up this area. Okay, and then we push it, the ET tube, all the way downwards towards the trachea, and it will end up into the lower end of the trachea. So through that we can provide the air to the patient. So that is about the few clinical anatomy that you need to remember. Thank you.